Hello and welcome to this episode of the Aig-Imoukhuede Foundation podcast. My name is Dr. Nonye Egekwu and I'm the Director of Health Philanthropy at the Aig-Imoukhuede Foundation, and I will be your host today. Today's topic, innovative approaches to healthcare funding in Nigeria, is one that is critical to the well-being and future of our nation. As we all know, Nigeria's healthcare system faces numerous challenges, from inadequate funding to limited access and affordability. Today, we are fortunate to have a guest who has been at the forefront of driving change in this sector. Joining us today is Mrs Fola Laoye, co-founder and CEO of Iwosan Investments Limited, a leading health investment holding company in Nigeria, and owners of Iwosan Lagoon Hospitals. Previously, she served as director at Investment Fund for Health in Africa, IFHA, and as CEO and chairperson of Hygia Group Nigeria, founders of Lagoon Hospitals and Hygia HMO. Mrs. Laoye also holds leadership roles on several boards, including FSDH Asset Management, Institute of Healthcare Improvement IHI, Society of Quality in Healthcare in Nigeria SQHN, and the Federal Ministry of Health National Tertiary Healthcare Standards Committee. She earned an MBA from Harvard Business School and is a chartered accountant with extensive experience from Ernst & Young and PwC. She has been a transformative force in healthcare financing across the continent. Today's discussion with Mrs. Laoye will cover the limitations of the current healthcare funding system in Nigeria, innovative funding models that could improve access and affordability, the potential of healthcare private equity in managing primary healthcare centers, and the policy frameworks needed to encourage private investments in healthcare. So, whether you're a healthcare professional, policymaker, or simply someone interested in transformative change in Nigeria, stay with us for an insightful and thought-provoking episode. Let's start by welcoming our esteemed guest. Welcome, Mrs. Fola Laoye. Thank you for joining us today.
Thank you very much, Dr. Nonye. Great to be here.
So, Mrs. Laoye, your work in healthcare investment has been truly groundbreaking. Could you share with our listeners a bit about your journey and what inspired you to get involved in healthcare financing?
Well, first of all, just to say, thank you for the honor and for the opening comments. I see myself as really just having, hopefully, been on the journey of contributing to what we all hope to see, as an improved healthcare sector. My journey really started, shall I say, not in healthcare. It started in financial services. So I studied as an accountant, and I think, as you read earlier, had spent my younger years in accountancy as well as financial services. But interestingly, I guess in the end, I couldn't fly too far because I come from what I would call a fairly strong healthcare family. Both my parents, were both doctors. My dad, a surgeon, my mother, a physician. And they actually had spent their formative years after studying abroad, coming back to help to set up the real beginning of the healthcare fabric of the country in the public sector. First at University College Hospital, UCH in Ibadan, which was I must say, teaching hospital, not just in Africa, but in the Commonwealth. And then after that, coming and being part of the very first team to open up Lagos University Teaching Hospital here in Lagos, Luth, where my father rose to become both CMD of the teaching hospital and provost of the college, So they had that twin responsibility of growing both what I'll call healthcare services as well as healthcare education and training. And so you can imagine that was, those are who formed me. And I know that, yes, at a point, I did work very hard at school, but somehow I just was not sure that, being a clinician was going to be my path. I was much more mathematical in my thinking and in my work. And so I was, finally, after having, finished my degree and my training, I went off to Harvard Business School and then made the pivot of joining what was the healthcare business that my parents had joined. They had since moved to the private sector to set up Hygeia and Lagoon. And I realized that there was a real role for financing healthcare, and that was something I could really use my skills, to really hopefully, to help to improve. So that was really the key. And, the challenge for financing healthcare was significant even at the time I stepped in. This is about, 25 years ago now. But certainly at that time, we saw two key things. We saw, first of all, a situation where healthcare spending was about 2/3 coming out of people's pockets. So, what you call out-of-pocket spending was about 2/3 of all healthcare expenditure in the country. And then the other 1/3 certainly was coming from government. But even when we added it all together, what made up the pot at that time was really small. In those days, it was probably, I think, around $20, $25 in USD terms per capita, which would be a lot lower now if I bring in the exchange rate and inflation. So I'm just trying to sort of paint a picture that over the last 25 years, certainly the twin issues of the amount of expenditure per capita being very small and the bulk of it coming from people's pockets had been two challenges that I realized that I needed to roll up my sleeves and help if we were going to grow a sustainable healthcare business.
Wow. Thank you, Mrs. Laoye. This is serious. Okay, so to begin with, let's take a closer look at the current landscape. So Nigeria's healthcare financing system faces quite a range of challenges. And from your perspective, what would you say are some of the key barriers and how do they affect access to and affordability of healthcare services in the country?
I think I already started to allude to some being, that overall healthcare expenditure. But let me also say this. The key reason why the healthcare expenditure itself has been so limited, certainly over the last 20, 25, I would say maybe even last 20 years, has been really due to the macroeconomic issues that the country has faced. Healthcare spend always tracks economic growth. Once you see an economy growing, then people have more money, obviously, to look after themselves. And therefore, the spend that goes with it is reflected, so once you see GDP growth, healthcare as a percentage of GDP, will continue to rise. And us having seen, and to be fair, if I go back to when I first returned and, entered the market, we were beginning to see that from 1999, I would say, maybe more like 2002 to 2006 or so, I believe the country grew its economy by 6-7% a year at that time. And in fact, our GDP got totally rebased. I don't know if anybody would remember. And at that time was a time when we saw the biggest increase in growth in healthcare spend. But since then, and since we have faced the level of economic hardship we faced, certainly that has been a challenge. Not an insurmountable one, but a challenge nonetheless. Now, side by side with that, difficulty in economic growth has also been a population that is still fast growing. And that has meant that the earnings, again, per head has been lower, with less to go around to more people. This has also put a significant strain on infrastructure around the country. And healthcare does depend on infrastructure, depends on everything from transportation to, potable water, to electricity, to just having, a decent environment. Because healthcare starts in the home. We can talk a lot about what we do when people come to, a place where they need care. But if we want to start with where does care start, it starts in the home. It starts with how do you teach your family, your children, especially healthy habits. And, how do you make sure your environment is really clean and so on. I remember, a few years ago, there was a major piece of, a major, shall I say, book that came out about the eradication of malaria in Europe, and how malaria was eradicated was largely based on, the environment, how, the government really could work with giving, a cleaner environment, and therefore, it eradicated mosquitoes, basically. And therefore, so I'm just trying to use that just to paint a bit of a picture in the kind of issues from an infrastructure perspective that, of course, the system faces. And then, of course, there's been people, and what I will call now, in today's terms, the Japa syndrome. Of course, back then, this is not the first time we have lost healthcare or professionals, or in fact all professionals in the country, but we've had a few cycles of this before. So it means that every time the country builds talent, we do lose the talent because they get exported. And that, of course, has meant that it's not been as easy to really hold and retain and grow our system. And I think particularly is to maybe put it in the context of what I like to call the tripod of healthcare, which is a tripod of access to care, the quality of care, and the cost of care. And it's very, very difficult to keep all three really growing at the same time. And very often, because of the infrastructure and the other challenges I've mentioned, we see the quality of care go down, we see the cost of care go up, and of course, trying to keep both, keeping the quality better and cost down, tends to have an impact on access. So access is that third one. And when we focus on access, we have to make sure that the other two are also going in the same way, whereby cost is low and quality is high. So it's a bit of a juggle, is the point I'm trying to make. It's what healthcare managers have to deal with on a day-to-day basis to really make sure that, the healthcare system can deliver to the people who really need it.
Okay, thank you, Mrs. Laoye. I think this is really interesting, particularly you mentioned out-of-pocket payments, human resources for health, and how all of these really tie in. Thank you for outlining these challenges. So, given these systemic issues, it's evident that innovative financing models are then essential, for improving healthcare access and affordability in the country, in Nigeria. What alternative funding models would you recommend, to drive positive impact in this area?
I think, one big one, which I know we've worked on over the last 25 years, has been the whole concept of health insurance, and what we typically call demand-side financing. Over the years, Nigeria has done what I will call mostly supply-side financing, which is really looking after, putting funding into building clinics, hospitals, employing workers and so on. And that was largely because, government back in the day really was, responsible for delivering care for every single, human being in the country. And we had close to a national health system or a universal health system, but this is going back 30, 40 years. When that system started to sort of break down, we started to see, public sector, other actors, what I'll call non-state actors, come in to help to deliver care. Of course, as I mentioned earlier, that spending on care became fragmented, became out of pocket and so on. But let me give you an example of out of pocket. Out of pocket literally means, here is, a woman or a man, let me even start with a man who, is looking after his family, has a job, but perhaps on his way home from work, for some reason or the other, gets into a motor accident. And that really, stops him from being able to go to work and earn his daily wage. Now, what does that mean? It means straight away, the rest of the family have to gather to get funds to be able to look after him. And then, of course, how to feed the family because he has been the breadwinner. And that's the kind of impact that this out of pocket, where every time there's an episode that needs attention, we have to then grapple around to find funding to look after the person who needs care. And especially if that person is a breadwinner, it has that knock-on effect in the family. And so that's why the concept of health insurance, the demand side, where you bring as many people together into one pool and let them bring a bit of funding every month, every year into the pot, such that if and when they need care, the funding is available. Now, it's insurance, and I know that insurance is something that's not been very easy for lots of our population, especially what I'll call our more rural and urban poor population, to grapple with and understand. But that is simply it. Putting something away for that rainy day when it is required. And we realize that indeed is a significant model of financing for health, because once the funding is there, that funding then goes into the supply side. It is used to pay salaries, it is used to buy drugs, it is used to pay the PHCN bill and so on, to make sure that the clinic or the hospital runs. And then that really creates the sort of sustainable model that we'd like to see. So insurance is something we've worked on, like I said, 25 years and counting. There's a National Health Insurance Bill, which became a National Health Insurance Act. Some of us took that act and really took what, the political will that government put on the table to say everybody in the country needs to be covered. We need to get to universal health coverage under this act. And doing so meant looking at devising insurance pools and schemes for the urban population, for the employed, for the public population, as well as for the rural population and for the poor. And in bringing everybody into that net is really where we feel would be the objective over time. We did some early work, particularly looking after what I'll call the rural and urban poor, and in primary care settings. And that early work showed us a couple of things. One, that yes, the poor really don't have enough to be able to put in the pot, and somebody needs to subsidize them. But two, that the health needs of the poor were, as prevalent as for the rich or for everybody else. So dealing with non-communicable diseases like hypertension, even diabetes, and certainly, of course, having to deal with the primary care issues of malaria, typhoid, and HIV. And not to talk of course, maternal health. All that needed to be covered. And so covering that has, became something that we could pull into that basket of funding that would then, go around the population. So I think, yes, those early studies and early work that we did then really helped to create what we will now call today state-supported health insurance. And, states are now taking that forward to think about how do they begin to pull their own baskets of health insurance. So I think that health insurance is certainly one that allows for access, for equity, and allows also for cost to be managed, because it's an economies of scale. It allows for a lot of people to come into the pot. Today, I believe something like 20 million people are covered. However, that's still 20 million out of 200 million. So there's still quite a way to go, but certainly the building up that pool of funding is going to be really important to really helping to finance healthcare.
Thank you, Mrs. Laoye. I think these are really insightful ideas, particularly with mentioning health insurance. We can't underscore the importance of health insurance. Thank you for sharing. Let's now explore a key innovative financing model: healthcare private equity. So while this model has gained significant traction in recent years, its application in primary healthcare centers remains limited. So how can the principles of healthcare private equity be effectively leveraged to improve the management and then the sustainability of primary healthcare centers, particularly like you mentioned, in rural areas and in the underserved areas across our continent, Africa?
Sure. And yeah, so private equity, maybe I start by just very simply trying to, explain very simply what it is. Private equity is really just private sector funding that comes out of individuals' pockets, corporate pockets, banks, and other financing systems who want to put funding into, a project or into a part or an industry, as investors. And it's called private equity because public equity is when you go to the stock exchange and you're raising money, in the public domain. Private equity is when you're raising it not on the stock exchange, but privately from the different, as I said, stakeholders. Now, private equity tends to go where a market has developed. So where there is a good enough market that can be seen and that can be sure that indeed there will be, to be honest, financial returns. Now, in the healthcare setting, there have been a couple of things that have made private equity extremely interested and attractive. One has been what I mentioned before about health insurance. Health insurance helps to scope a market. The numbers I raised earlier, like for instance, the fact that there are 20 million people who are insured, that's something that an investor, a private equity investor can deal with and say, okay, there is a market. So that's the first thing when we think about primary care. We know there's a market for primary care. Primary care is the beginning of the care pyramid. It's the care that people need every single day. And as I've mentioned, even to cover maternal health, to look after children, to look after women, and to look after all the key diseases that we know are already in the country. They all start in the community, which is where the primary health centers reside. So certainly there is a market, and private equity can apply itself to thinking about that. Beyond there being a market, there's also in the healthcare system, there's also the need to really think about impact. So here we're not thinking only about profit. We're thinking about, financing to sustain, so the sustainability first and foremost, that there's a sustainable healthcare system that is providing to the people. And based on that, there is as I mentioned, impact, impact that there are more lives that are being looked after. We are getting a healthier population, which of course drives economic growth because, again, the adage of health is wealth. We need to be healthy to be able to work and really be able to develop and deliver, shall I say, output that then helps us to grow the economy. So private equity also, and there are, shall I say, specific parts of private equity investors who are called impact investors, who come into this space thinking about, we don't only just want to see, naira and kobo or dollar and cents. We also want to be able to track and see impact. We want to see the number of babies being born. We want to see the number of women who don't lose their lives anymore, from childbirth, and, real important indices and metrics that can be measured. And seeing that then delivers just as much as the financial bottom line delivers. Now, having said that, what is the other key thing private equity needs to see? Private equity tends to need to see scale. And so what happens with private equity is that it's this kind of funding that comes together in a more corporate way. Rather than Mr. and Mrs. Sule just going and saying, okay, we've made a bit of money, we have a little bit of excess from, other business we're doing, let's go and help to set up a hospital. Or even Dr. James, who says, this is my trade, this is my work, let me put my earnings in here. That's private equity. But the type of private equity that I think will be transformative is when you get a collection of different investors, Dr. Sule's money, Mr. James's money, and everybody together in one entity. Then there is sufficient scale of financing. And also that sufficient scale of financing looks for sufficient scale in terms of the delivery system. So what's very important would be important for primary healthcare would be for primary healthcare to be looked at from a network point of view. So rather than just taking one PHC, but taking several at the same time. kind of work that the Aig Foundation has been doing with the Private Sector Health Alliance, where we've been collapsing and bringing private primary healthcare centers together, in different parts of the country to create a bit of a network. With that network, we hope to find economies of scale. So, for instance, supply chain gets easier because not only will you be buying drugs and materials for one center, you'll be buying for 15 or 20. Helps us to negotiate price, helps us to, retain costs. We'll be able to create training programs for staff. We'll be able to think about things, like I said, in a bigger scale. Once we can do that, then private equity from a corporate perspective can come to the table and say, there is scale here. We can bring investors that can help to really, work with those who are delivering the service and really yield, impact as well as a sustainable return. That is what folks like myself and our firm as Iwosan, that's what we look for. We do look for scale, because once we see scale, we are able to say, okay, we have been able to bring, a community of investors together who can then work with a community of healthcare delivery systems.
Thank you, Mrs. Laoye. I think this is quite fascinating to hear. And just thinking, for such kind of innovative models to then succeed, I believe that supportive policy frameworks, regulatory reforms, and the right kinds of incentives are then essential. So, from what you said, could you then propose some effective policy frameworks or reforms that are necessary to foster and, just engender innovation in healthcare funding and attract more private investments into that sector?
I think certainly, even as we're thinking about regulation, regulation also needs to, we start also by saying, what are the big things that are or theories of change in the market, in the environment, in the industry? Certainly, technology is something that we know is significant. And therefore, the investment in technology, is one that we look forward to, not just as investors, but even from a regulatory perspective as well, because we want the regulators to think about how does technology work, what can it do to improve the care system, what can it do to engage and ensure that investments that come into the system are also well safeguarded. So I'll say the government's own approach to technology and the use of it and how it is regulated is certainly important. So, for instance, one of the biggest things in healthcare is telemedicine. Telemedicine meaning that you can give healthcare services virtually, either because a doctor or a healthcare giver even is sitting in a different place and from the person getting the service, or because that is the system through which reports and diagnostics and diagnosis is being made, or because even that's the process which the supply chain for drugs and so on is being managed. So all of that is extremely important and innovative and can really help to scale. But of course, we have to make sure that there's enough regulation around it. There's data protection, that we make sure that access to data is well kept. We make sure that people can be properly identified. So if somebody is being a caregiver from afar, how do you make sure that that person is really who he or she says they are, and that they are well qualified and so on? So that's one big thing. In addition to that, of course, everything I've talked about, be it health insurance particularly, certainly needs to be well governed, by policy. And certainly, yes, there is, as you know, the National Health Insurance Agency, there is the bill, and there is the policy framework around insurance, both at the federal level and at the state level, which is very important. In addition to that, is also seeing the government themselves putting their money on the table and putting their money where their mouth is, in a way, and which is through the National Health Bill. So we have a National Health Bill, which is now a National Health Act, through which there is the framework for 1% of the federation's income to be put into healthcare. And through that 1% to fund primary healthcare and to fund health insurance and so on. And that's all governed by law. And from that law has become the Basic Healthcare Provision Fund, BHCPF, as the way to execute on that law. So again, looking at the law itself, the policy framework, the execution through PHCPF, and ensuring that we hold government accountable to that whole ecosystem is also important. And then more recently, there has been now, under this current government, 2 key pieces of reform. One is unlocking the value chain, which is really, really working and realizing that some of the key areas of healthcare that we need, for instance, is drugs and consumables. Almost, I don't even know what percentage, but probably close to 95% of which are imported. Now, with the pressure on the dollar and everything that is going on, we know that is not sustainable. So the government itself and the president himself having the political will to say we need to unlock the healthcare value chain. We need to look at areas that will help investors bring in more funding to produce, to deliver service, and so on, has also been extremely important. And finally, the work around reforming the quality of care. Government is doing quite a bit of work now to really take what I'll call a regulatory agenda to make sure that, again, those who are in the marketplace saying they are delivering care are eminently qualified. They can deliver the right quality. They can eradicate errors, because errors do often happen in the healthcare space. And in doing so, they can make sure that indeed there is an enabling environment that really does create the right incentives for those who are there, are ready to invest, and those who are ready to deliver, on the proper care mandate. So certainly, I think already there is a fair amount of policy framework in country, and there is even more coming out at this present government. And of course, we as private sector want to make sure that we're always dialoguing with government. And therefore now government is actively working with institutions such as the Society for Quality in Healthcare, Healthcare Federation of Nigeria, HFN, and other private sector-led organizations to really be able to ensure that, it's a symbiotic relationship as we think about policy and, and execution.
Thank you, Mrs. Laoye. So it's clear that we need a strong policy environment. You've talked about data, quality of care, policy, and political will. Drawing from your extensive experience, what would you consider to be the critical elements really for driving transformative change in the healthcare funding in Nigeria?
I don't know. It's very difficult to put one's finger to say there's any one thing. I think certainly having the right, the enabling environment, because investors want to bring their money into an environment where, like with all the things we've said, matter, where regulation is great, the demand side is clear, with an insurance, backing and setup. Knowing that, funding that goes in, the infrastructure is also going to be in place. So government doing its own bit on the infrastructure side is also important. And finally, that, private investment will be matched naira for naira by government money. So I think that's also important, that we do see government also come to table with their own investments as well.
Great. Thank you, Mrs. Laoye, because this is really interesting, particularly speaking about a conducive environment, government matching dollar for dollar, naira for naira. I think those are critical. And before we conclude, maybe we should just look at the role of public-private partnerships in this whole ecosystem that we've talked about. How can PPPs then be utilized to support innovative funding models and enhance healthcare access and delivery throughout Nigeria?
Sure. Maybe just to start by saying that, look, PPPs are not only something we're advocating in Nigeria. PPPs happen all over the world. Even more so, particularly in parts of the world where there is the path and the drive to universal health coverage, even when there is the model where the public sector delivers more of the care. Still, I believe governments have understood the role of private sector. They have understood the ability of the private sector to also command, and bring significant financing and investment to the table. And therefore know that there's a win-win there in that relationship. If you look at the UK, for instance, the NHS, the National Health Service, which is still very much a universal health coverage, mandate, still all the most recent investments in hospitals particularly, and even primary care in some areas, have been driven through what you call PFIs, private finance institutions, who have come in and worked out agreements with government to really help to finance while understanding what the long-term return and impact will be. And Nigeria is no exception. And I think that conversation is now becoming more real. We are working ourselves with the Lagos State government on a project called the Lagos State Medical Park, which is a well-constructed PPP arrangement, with well-defined concession terms, strong stakeholder input, and the stakeholders are, multifaceted, be it the construction guys, the operators, the finance team. Everybody is at the table, but thinking particularly about how do we deliver healthcare, how do we train even and increase skills, and how do we ensure that, what we are all putting together from the public sector and the private sector is really, a project that will deliver the right level of care, for the foreseeable future. So I think certainly, and the other key thing about the good PPPs is having responsibilities clearly mapped. So knowing the role of the government as being the not just the instigator, but also having that sort of steering and oversight, whilst you then have the private operators and the private partners and financiers really deliver on their own mandate as well. So I think PPPs are here to stay. I mean, we're seeing PPPs perhaps more so in other sectors. I know that there are some very topical ones of private investment, for instance, in refineries that are going on in the country. But the truth of the matter is that we realize that, yes, the private sector can really bring, can marshal a significant amount of financing to support government. And government, can also work with the private sector to really deliver on its mandate. And certainly that is the case in healthcare.
Thank you, Mrs. Laoye. I think this is really important, particularly the dynamics between private and public sectors and how this can impact the overall outcomes for the country. This has been an incredibly enlightening conversation, Mrs. Laoye, and we've discussed the shortcomings of the current healthcare funding system in Nigeria. We've explored innovative funding models and emphasized the importance of private equity principles and all the supportive policy frameworks, including political will, required. Your insights into leveraging the public-private partnerships to address these challenges have been, I must say, invaluable. And so as we conclude today's episodes, I want to ask if you have any final thoughts or, key takeaways that you would like to share.
No, thank you very much, Nonye. It's been a great conversation. Time has really flown, I must say. Just to say that, of course, I'm very, very pleased also to the work that the Aig Foundation and, being a non-state actor, but having come really from the private sector, you are sitting right in the middle, and at the right place, to be honest, between what public sector can bring and what, what private sector can bring to the table, and also how to really, embrace the public sector objectives, and certainly particularly in primary care. This is a really big task, but, I think certainly conversations like this, the vision and the strategy, will really help us with execution. Thank you.
Thank you, Mrs. Laoye. Thank you so much for sharing your invaluable insights and your vision for transforming healthcare financing in Nigeria. I must say that your efforts are making quite a profound impact on improving healthcare access and affordability across the country. And to our listeners, we hope this episode has deepened your understanding of both the challenges and the opportunities that exist within healthcare financing. Innovation is the catalyst for progress, and by embracing new models and by forging strategic partnerships, we can move together toward a more inclusive, equitable, and sustainable healthcare system in Nigeria. So we encourage you to explore the potential of innovative financing models and actively support initiatives, particularly as they come, that aim to enhance healthcare accessibility and affordability for all. Thank you so much for tuning into this episode of the Aig-Imoukhuede Foundation podcast. Don't forget to subscribe, share, and follow us on all our social media platforms for more insightful conversations. Until next time, stay inspired and committed to making a difference. Bye-bye.
This has been an episode of the Aig-Imoukhuede Foundation podcast. Remember to subscribe, share, and leave us a review if you enjoyed this episode. Until next time, stay inspired and remember that together we can build a brighter Africa.